Welcome to the Fear and Greed Daily Interview. I'm Sean Aylmer. Healthcare in Australia has been in sharp focus over the last 3 years. Everything from the capacity of our infrastructure to deal with the pandemic to the state of our hospitals and the role of private operators within the broader healthcare sector. I thought we should take a closer look at this space, both from a social perspective and from the perspective of the businesses operating. Lucy Darville is the head of Bain's Australia and New Zealand Healthcare and Life Sciences practice. Lucy, welcome to Fear and Greed.
Thank you, Sean.
So how would you describe the current state of healthcare in Australia? Let's start with maybe hospitals.
Absolutely, Sean. I think it's helpful to understand Australia's healthcare system in the context of where it was pre-pandemic and then where it is now post-pandemic. So between 2010 and 2020, our public hospital sector was very strong. And so we were seeing a decline in private health insurance penetration, which was putting private hospitals under pressure as individuals were not seeing the value of private health insurance because there was a very strong public health system, which, as you know, is universal and so provides free access. That has really shifted with the pandemic. And so we have seen private health insurance penetration increasing post the pandemic. So it's now up at around 47% of Australians. And that in turn is creating demand in the private sector for private hospital because Australians are now concerned about their health and are very much wanting to make sure that they've got that protection if they need it and go to the private hospital sector. So I would say that there is a shift at the moment between the public and private hospital dynamic. I would say the hospital sector as a whole is still very challenged. You will hear a lot of Australians use the word post-COVID, and COVID is still very much apparent and prevalent for our frontline working in the hospital sector. And so you touched on it in your introduction. There are workforce challenges which are incredibly hard, and at any given time, wards in hospitals, whether it's public or private, will be operating down on capacity between 15 to 20% on any given day. And you're also seeing in the public sector very big backlog issues and wait times. The AMA last year, in their report for the end of financial year 2020, reported that they estimated 300,000 patients nationally were on a wait list. And they estimate that that is likely to blow out to be 500,000 Australians by the end of FY23.
Wow, that's not good. Having said that, Lucy, the government wants people to be in private healthcare though, doesn't it?
I would say that the government wants to ensure that we have a vibrant public and private healthcare sector because we need both to be able to maintain our universal healthcare system. And we want to make sure that our public healthcare system is there for those individuals that can access care, and we can do so in a way that they are not left with some of the accessibility challenges that you can see in markets like the US. And so it is incumbent, I would say, on Australians and the government to encourage people with the means to pay to ensure that we have a vibrant private hospital sector because that ensures the sustainability of the sector as a whole. It also provides a very attractive employment pathway for doctors as well, and a number of our doctors work between the public and private sectors.
Okay, so notwithstanding the AMA's numbers in terms of wait lists and things like that, are we heading in the right direction? Are we not going fast enough, perhaps?
I would say that the pandemic has enabled innovation and disruption in a way that we have not seen previously in healthcare. Healthcare typically moves in a 10 to 20 year time frame. And what we've seen in the last 3 years is an acceleration of things like new models of care, where you are seeing the embrace of telehealth, you're seeing the embrace of remote models of care, and you're seeing hospitals really thinking creatively about, well, how can we do more in the home with our patients, or how can we reduce the time that people have to spend in hospital? So I would say that there is an element of innovation that is happening. To improve our hospital sector, you actually need to take a systems approach. And I think what concerns me is when people look at our healthcare system in silos, they are missing the point that it's a very complex system that interacts across primary care, secondary and tertiary care, as well as allied health and community-based care. And any change that you make in one of these silos is going to have flow-on effects. And to answer your question about are we moving fast enough, I think it's encouraging that the new government has established its Medicare task force and has released its first report strengthening Medicare. The concern that I have is healthcare is such a political hot potato. And so, in order to be able to drive reform, any government is going to have the political capital to do so. And we are not seeing that pace of change that we would like because of the challenge it is to reform healthcare, because of what can happen at the electoral box. And we saw that with the Medicare Scare campaign a few years ago.
Stay with me, Lucy. We'll be back in a minute. My guest this morning is Lucy Darville, head of Bain's Australia and New Zealand Healthcare and Life Sciences practice. Okay, one of the things that does seem to be getting voters' attention is the state of GPs, not individual GPs, the state of the network of GPs in Australia. It just seems very challenging for someone to go to university, work in a hospital, come out, become a GP, and actually make a living. It seems that we need changes at that level of the health service.
We absolutely do, Sean. Our primary care system is the backbone of our healthcare system, and we need to have an incredibly strong primary care network in order to make sure that we are focused both on prevention and well-being of individuals, as well as making sure that the right chronic disease management is in place, as well as ensuring that individuals get the right referrals into the hospital network as and when they need it. The challenge with our primary care system at the moment is that our bulk billing rates are in decline because GPs are not able to create a sustainable living off the back of the Medicare rebate, which was frozen in 2014, actually. So it's not a pandemic issue. It was frozen from 2014 and was lifted in 2019, but has not been able to keep pace with inflation and the gap that was created between 2014 and 2019. So to answer your question in terms of, well, what does that mean? What's the reform that's needed in the primary care space? What's going to be really important is in the near term, there probably is a short-term boost that's needed in terms of the primary care rebate in order to ensure that GPs are better supported and that patients have access to affordable and high-quality healthcare. Longer term, though, that increase is not going to be financially sustainable unless you look at how the whole system interacts. And there will have to be winners and losers, Sean, in terms of the reform that happens. But in my mind, primary care is the absolute backbone of our system, and that absolutely needs attention now.
What about allied health? And I'm never quite sure what allied health means. Like, I always struggle to get my head around what we're talking about. So can you define it and just tell us how it sits within the system?
Yes, and so allied health is a really key part of our overall system, and allied health includes your services such as physiotherapists, dietitians, and it's really those supporting health services, I would say, that supplement what you get in the primary care space, which is your general practitioners, psychologists, and dental, and what happens in the secondary and tertiary care, which is your outpatient and inpatient treatment with private and public hospitals. And so in the allied health space, they have a really important role to play in integrated care. And when you think about the future of healthcare, there are really three words that matter. It's personalization, it's innovation, and it's integration. And what increasingly you need to see is allied health professionals being integrated with the work that's happening in primary care in order to make sure that with the rise of chronic illnesses, we are providing the right care that Australians need. And to put that in context, our healthcare system at the moment is very much geared towards a reactive care, and it's very acute hospital centric. And we need to shift that to make sure that now that 50% of Australians have at least one chronic condition, we need to fundamentally shift the paradigm to focus more on primary care and allied health and even community care as well.
How, Lucy? How? Simple question. Well, probably not.
I know it's the $1 million question. I
Yeah.
think what we're seeing is really it needs to happen in two parts. I would say that the private sector has a really important role to play to start to demonstrate the benefits of integration. You can already see what Medibank Private are doing, what the likes of the other insurers such as Bupa and NIB, they are starting to think through, well, how can we start to join the dots for our members more effectively, and how can we start to help the providers, primary care, allied health, and secondary and tertiary care, how can we help those providers to create a more seamless experience for our members? And so I do think that the private sector has an important role to play in terms of some of that innovation. And also the hospitals have quite an important role to play of how they are starting to tap into the primary care networks. But as I touched on earlier, there really is the need for broader system level reform by the federal government. And that starts with really thinking about what are the needs of Australians that our healthcare system needs to be geared towards, and then making sure that we are funding and supporting those new models of care effectively. And those new models of care need to focus on both prevention as well as also thinking about lower cost models, which, as I said earlier, are going to result in winners and losers.
And the political will, of course, we need the political will for this to happen, which is kind of the sticking point.
Absolutely. And the challenge for the current government is there's a whole range of other challenges that they need to face as well. So, climate change, you spoke about that a few weeks ago in terms of the energy transition. There's pressures across all parts of the economy. And so it really is a question of balance. I would say that when you look at healthcare, we really do need to act in the sense of it feels as though the pressures on our workforce and the fiscal challenges that are being faced in 5 years' time, we will not be able to pride ourselves on having a universal healthcare system if we haven't tackled the reform question.
Lucy, thank you for talking to Fear and Greed.
Wonderful. Thank you, Sean.
That was Lucy Darville, Head of Bain's Australia and New Zealand Healthcare and Life Sciences Practice. This is the Fear and Greed Daily Interview. Join us every morning for the full episode of Fear and Greed, Australia's most popular business podcast. I'm Sean Aylmer. Enjoy your day.